Ghana's public health system is in shambles with crumbling infrastructure, poor governance, and a mass exodus of healthcare professionals. Recent events, including the controversial dismissal of the Tamale Teaching Hospital CEO, have sparked a nationwide debate over ministerial overreach and institutional autonomy. The system's dire state is further exposed by medical tourism among public officials, a brain drain of nurses, and support services in hospitals. With Sustainable Development Goal 3 hanging in the balance, can Ghana's healthcare system be salvaged, or will it continue to fail its citizens? My colleague Idris Hamzata tells us more in this explainer.
Ghana's public health system is facing unprecedented challenges, with recent events highlighting the dire state of healthcare infrastructure and governance. The Ghana Medical Association (GMA) has strongly condemned the dismissal of Dr. Adam Atiku, the Chief Executive Officer of the Tamale Teaching Hospital. The GMA describes the action as an abuse of power and a violation of due process by the Minister of Health, Kwabena Minta Akando. Dr. Atiku was dismissed from his position on Tuesday, April 22nd, after an unannounced visit to the hospital by Minister Akando in response to the death of a patient, Salim, who reportedly died due to the lack of a functioning ventilator at the facility. But the Member of Parliament for Tamale North, Suhini Shaibu Al-Hassan, says the dismissal of the TTH CEO should not be linked to the altercation or the death of the 31-year-old patient. However, in a strongly worded statement issued on Wednesday, April 23rd, the GMA condemned both the dismissal of Dr. Atiku and the treatment of medical personnel at the emergency unit during the visit. The controversy has triggered a nationwide debate over ministerial outreach, institutional autonomy, and the fragile state of Ghana's public health infrastructure. Despite numerous healthcare facilities nationwide, support services plague the system, leaving patients wanting. Ghana's healthcare system lies in tatters, scarcely exposed by journalist Godwin Asidibe's documentary, Trouble Mog, highlighting the silent crisis at Kolebu Teaching Hospital, the highest referral hospital in Ghana. Ghana's hospitals that were previously world-class have been reduced to symbolic edifice due to political negligence. In November 2023, it took the Asantehene Otumfuo Osei Tutu II to launch an initiative dubbed He Konfonechi Project to raise $10 million in a public fundraising drive for the renovation of the 70-year-old inpatient wards at the Konfonechi Teaching Hospital, a major referral hospital in Ashanti region. The renovation became necessary after portions of the hospital building developed structural defects, including damaged ceilings, deteriorating tiling, and poor ward conditions. Medical tourism, a burden on taxpayers, is on the rise. It is not surprising that public officials travel abroad, mainly to Europe, North America, and Asia for their medical needs due to a lack of confidence in our health system. Vice President Professor Jane Nana Opoku Ajaman recently had her share of medical tourism. In 2016, Africans spent over $6 billion on outbound treatment. In recent past, some African leaders, including Levi Mwanawasa, Malam Bakai Sanha, Meles Zenawi, and Omar Bongo from Zambia, Guinea-Bissau, Ethiopia, and Gabon, respectively, died while seeking treatment abroad. Failure of Ghanaian leaders to improve healthcare has led to uncontrollable brain drain, with more than 6,000 nurses emigrating in droves to search for greener pastures between January 2023 and August 2023. The picture painted above is shameful, raising eyebrow as to whether or not Ghana will achieve Sustainable Development Goal 3, which talks about good health and well-being. As long as public officials embark on medical tourism, the ambition for better health infrastructure will remain an illusion. Also, Ghana's dream of benefiting from the projected $55.83 billion medical tourism market seems like a distant mirage if public health systems continue to be in a depressing condition. Addressing the challenges facing Ghana's public health system requires a multifaceted approach to strengthen healthcare infrastructure. Increased funding for hospital renovations and equipment upgrades is essential. Implementing a maintenance culture will prevent infrastructure decay, while investing in modern medical technology will enhance diagnostic and treatment capabilities. Also, improving working conditions and salaries for healthcare professionals will boost morale and retention. Additionally, streamlining patient flow and implementing quality improvement initiatives can significantly enhance service delivery, not forgetting effective governance and accountability mechanisms, which are also vital. And finally, strengthening institutional autonomy for hospitals will enable them to make decisions that best serve their patients. For Globe News, Idris Hamzata.